Allison Gutwein, Executive Director of the Zionsville Chamber of Commerce, and today I am here with Gene Davis. He is Infection and Control Prevention Director at Witham Health Services, and due to the COVID-19 virus and a number of closures that have happened here recently, we would like to speak to you today about the virus and get some very clear information about the virus out there to our businesses. So, Gene, this virus has come on so rapidly, and it seems like there's quite a response. What makes COVID-19 so different?
The coronavirus has been seen to have transmit from person to person very, very easily. It is something to be concerned about, but I'm not sure that people need to necessarily panic about, but just be concerned about. Mm-hmm. It has received a lot of attention in the news media, therefore people are right now really alert to what's going on.
Sure. And that level of alertness, does that really pertain to the virus itself or what people think might be coming with this virus?
I believe that a lot of the alertness to this virus is a lot of the unknown. People do not know what it is. We've heard about this. It's been in distant lands, and just in the last probably 4 weeks, we have seen it actually now in the United States. So therefore, that unknown, that uncertainty, what's going to happen next is what I believe a lot of the alarm seems to be.
Sure. So how is it transmitted?
How's it transmitted? It is airborne transmitted. Once we breathe out, we cough, an individual does that, it can actually then land, the virus can actually land on surfaces and can be transmitted either through the air from person to person or from touching something that the virus has actually landed on.
So if it lands on a surface, what can people do in order to clean those surfaces properly?
First of all, people need to be aware. I think that's one of the most important things, is that they are aware of how they are feeling, so that if they are having problems such as a cough, if they're having problems with a fever, that those are the signs and symptoms that can be coronavirus. That is also a sign of many viruses right now. So it does not mean that if you have a fever or you're coughing, you have coronavirus. And once you identify that you have a virus, all viruses we should be treating the same, and that is we should be cleaning the surfaces. They need to clean it with disinfectants. The bleach wipes are appropriate. People should be washing their hands to start off with. They should be covering their coughs or if they sneeze, not with their hands, but they should be doing it in their elbow, or with a tissue if they feel like they must cover their face with that.
We have a number of employers that have businesses, one business, multiple businesses in Zionsville and the area. What can those employers do in order to keep their employees safe and their patrons safe?
I think that's a very good question, and I think you brought up 2 points. There is two individuals we need to think here. We need to think about the employees, and we need to think of patrons. Employers need to be thinking about their employees. It's one of their greatest assets that they have is their employees. So thinking about them, checking on their employees, making sure their employees are not coughing, do not have fevers, and make sure that their employees are well. Mm-hmm. That is the most important. If anyone is sick or anyone has symptoms, it doesn't matter whether it is the corona or influenza or anything else. People who are sick should not go to work. They should stay home, they should treat the symptoms, and they should drink plenty of fluids and rest. So employers need to be checking on their employees to make sure that they are following those guidelines. The other consideration is their patrons or their customers as they come in. Being aware, making sure that as people come into your business, are they demonstrating signs and symptoms of being sick? And are we making available to our patrons or to our customers alcohol hand sanitizers or tissues so that they can have something to cough or sneeze into?
If someone shows symptoms of a coronavirus or an influenza and does self-quarantine and stays at home, after they have gotten over their symptoms, how long should it be before they return to work?
The government and the leader CDC states that a person with coronavirus should be quarantined for 14 days after the symptoms have started. That is not the typical isolation or quarantine for such things as influenza. Influenza, oftentimes you need to stay away from anyone for at least 24 hours after symptoms have resolved. So for those people that have a diagnosis of coronavirus, it should be 14 days. Any other symptoms, I would say at least 24 hours after symptoms have resolved.
So with regard to business closure, there's a number of governmental offices and the schools are closing in this area. What would you say to businesses that are questioning whether or not to close?
I would leave that decision to the public health officials and to the city officials to make the decisions, and to the business leaders if they need to make that decision.
How do you know whenever your symptoms are such that you feel like you need to seek treatment at a hospital? What do you do in that case?
What we are telling people to do, that if they believe that they may have the coronavirus, or the person is demonstrating signs and symptoms of being sick, the first thing that everyone should do is they should contact their primary care provider. Call them, let them know what their signs and symptoms are. The primary care providers and hospitals are all going to ask the same questions. These questions are, have you traveled in the last 30 days outside of the country? Have you been in contact with anyone with known coronavirus? Are you having a fever? Do you have a cough? And how long has these symptoms been going on? Once your provider has the answers to these questions, he or she will make a determination at that time what testing needs to be done. Now, people need to understand that this testing for coronavirus is a decision that is made by the state health department. A provider, a hospital, does not make the decision to actually test. They ask the state if they meet the criteria, and the state makes the determination.
So with the town offices and the schools temporarily closed through spring break, what does that do in order to limit the spread of COVID-19?
The goal of these closures is to try to prevent the virus from spreading to person. And the goal is to have fewer people together where the viruses can spread from person to person. Now, this action of limiting congregants of people together will only be as effective as the people who continue to abide by these rules that are implemented. So therefore, if we are not meeting in large groups in schools, in meetings, people cannot not do that, but turn around and get together in large groups and parties and get-togethers outside of this. It will defeat the purpose. If a person is sick, they need to stay home. If you are having symptoms of cough, fever, sore throat, then stay home. Self-contain yourself. If your symptoms are not getting better, then contact your doctor. Do not go out. Do not go about. It's important that people are also washing their hands and limiting their contact among other people who might be sick. I think it's important that our community realize that both the Chamber and Witham Health Services is here to serve our community and to assure them that there is no need at this time to panic, but that we will be here to continue to serve their needs.
Thank you for joining us today. We appreciate Witham Health Services being here with us and talking to us more about COVID-19. The Chamber offices will be closed until April 6th here at the Town Hall, but we will be checking our information remotely, so please email us. Also, all of our events that we have had scheduled up to this point, please check social media. Those will have changed, and we will be posting updates to those here shortly.